Okay, so I am Stacy, the local occupational therapist student that's here. Today I have brought in two PTs. This is Dr. Reilly and then this is Dr. Gros. And they are from
3D PT.
3D PT. Okay, I knew I was going to forget a letter. They're from 3D PT, which is actually not too far from here. It's within walking distance from this campus. So if the funding and everything is right, then you may be able to see these wonderful doctors. So they're going to talk to you a little bit about physical therapy and the use of ergonomics and really building up your body. So I will leave it to them.
Thank you. Okay. So we're just going to get started. We don't want to take up too much of your time. We know you all have been busy today. And Dr. Stacy is going to be finishing up at the end with her presentation. So just a real quick overview of what we're looking to cover with y'all. We want to give you some background about who we are and where we're located. Understanding several kind of lower extremity overuse related injuries that if you haven't experienced, you may and hopefully don't experience. Briefly teach you proper lifting mechanics and kind of standing posture if you're not already aware of that. And then we brought some hip, knee, foot and ankle, lower body, neck stretches for y'all to have as a resource to try to take care of your bodies when you're not working.
So a little bit about us. 3D Physical Therapy, we started 15 years ago. It was kind of a one-man show. Our CEO was a physical therapist, started it. He was working as the only physical therapist. Over time, over the past 15 years, we're now in 2 locations. We have about 6 to 7 full-time therapists at each. Our closest location is where Marissa and I both work, just up the street next door to Grimaldi's in the big glass building. We're on the first floor, and we have another location in Uptown on Oak Lawn and Lemon. We kind of pride ourselves on like a boutique style clinic. We see a smaller caseload than the traditional outpatient therapists. We treat a wide variety of injuries, head and neck, low back pain, head to toe, really, all of our therapists. We have a couple specialties like pelvic floor, return to sport testing. We use a variety of techniques, cupping, traditional dry needling, Graston, blood flow restriction, and other modalities. So, how many of you have ever had pain related to work or school? And how many of you have ever sought out physical therapy services for those pains?
Okay, couple.
Great. So, the data, the research shows that 71% of stylists report pain associated with their work, with 50% of the injuries knee and or foot related, 39% of injuries were lower back related, and 38% of injuries were upper back or neck related. Why do you guys feel like these numbers are so high? Any answers? Yeah. Standing.
Mm-hmm.
Yeah. No, please answer. Yeah, exactly, both. You're doing repetitive movements. You're standing a lot of the time all day. Some of the aesthetics, you're sitting in non-ergonomic chairs all day. You're getting in different positions. You're standing on hardwood surfaces, things like that. So those can absolutely lead to some of the pain and injuries that we're talking about.
Okay, so we're going to start at the foot. I don't know if you can see the white text very well, but plantar fasciitis, have any of you heard of this before? Has anybody experienced this before? Okay, so what this means is it's an inflammation of the tissue, the fascia, the connective tissue along the bottom of your foot that connects the heel to the toes. And it can result in heel pain. It can result in painful walking. It can also feel more like a stabbing pain, like a knife kind of going into the heel. When getting up from sleep, that's kind of like the most common report, those first few steps in the morning getting out of bed. It's typically from, a lot of these are overuse related. That's why we're bringing them to you. Sudden changes in activity. So if you just change shoe wear, that can kind of bring it on. If you went from being in school where you were sitting a lot or didn't have a job and now all of a sudden have a highly demanding job where you're on your feet, that can potentially bring this on. Lots of walking, lots of running, those kinds of things. It's typically managed with physical therapy, stretching. If it's more aggressive, your doctor might put you on steroid medication or anti-inflammatories, night splints, which is a bracing device you wear on the bottoms of your feet. It rarely needs to come to a surgical point, but typically can be managed with appropriate stretching, massage, and supportive shoe wear. Moving up the body, the next kind of most common things that we see in y'all's profession are hip and knee inflammation. Bursitis is a common diagnosis that is sent to us. And bursitis is basically these little fluid-filled sacs that we have all over our body. You have them on your elbows, in your shoulders, your knees, your hips. Those fluid-filled sacs also become inflamed, typically because there's some muscle tightness around, or if that joint is being loaded too much for too long of a period of time. Or again, similar to the foot, if you had a drastic change in your activity level or your activity demands, again, managed very similarly to the foot pain. So you're gonna notice some trends here. Low back pain. How many of you have suffered from low back pain before? Yeah. So most of us at some point in our life will experience back pain, whether we're in, whether you work as a stylist or whether you work at a desk job. This can result from a muscle strain, right? That bending and lifting, you tweaked your back. It can be from a structural problem like scoliosis, where you have a curvature of your spine. If you have a problem with one of the discs in your back, if you have arthritis, various reasons. Occasionally that back pain can cause leg symptoms. So this is what would commonly be referred to as sciatica. So if you have numbness or tingling or burning pain or symptoms into your leg in some capacity, there's a chance that that leg pain may be coming from your back. And so that we typically would evaluate that in physical therapy. We try to prevent back pain through, again, recognizing proper lifting mechanics, proper working positions, strengthening and kind of stabilization exercises of your spine and your core, and just body awareness. And then the final category we wanted to talk about, and that Stacy had asked us to talk about, was neck pain. So similarly to low back pain, it can be caused from poor posture, strain, or kind of throwing out a muscle within your neck and shoulder area, a pinched nerve or a bulging disc if you have that for whatever reason. And then stress is another common cause of neck pain, which we don't see so much in some of the other areas of the body, but the neck muscle tends to carry a lot of life tension that we have. So one of the things we tend to evaluate with neck pain is are there contributing factors, like do you clench your jaw when you're working, when you're stressed, when you're sleeping? That can contribute to neck pain sometimes. Do you experience headaches? Sometimes the headaches may have more of a tension component that comes from the neck. And then similar to the low back, if you're experiencing numbness or tingling into that hand, sometimes it's defaulted to being diagnosed as carpal tunnel, right? Y'all are at higher risk for that just with what you're doing with gripping and manipulating with tools and equipment, but sometimes that can be coming from up above, so that's something we would evaluate in PT. So the handouts, I'm not going to go too in depth with these because these are what the handouts are going to be for, but just an overview. We'll go back to the foot and ankle first. A few things that can help mitigate that, and I tried to include easy things that y'all can do with minimal equipment, whether it's when you're working here or at home. Calf stretching. So the first picture on the left side of the screen and the fourth picture show some ideas for that. Calf raise exercises, so in between clients, if you're going up and down on your toes to kind of build strength and endurance in those muscles. Foot exercises, so doing toe spreads within your shoes or if you're barefoot at home can be helpful for building that arch support. And then stretching of the bottom of the foot. That's what the seated exercise in the chair is showing. Can help all with that foot and ankle diagnosis we were talking about before. Hip and knee stretches, these can also help the lower back, which we'll get to in a second. But seated and lying down stretches to address some of the gluteal muscle, which can get very stiff if you're doing a lot of lifting and carrying and holding of equipment. Laying down on the back, that second photo of the female with the strap around her ankle, that is a stretch for that front chain of the leg and of the hip flexor. And then the final stretch is another variation of that if you don't have a space at work that you can lie down. It's a kneeling version, or like for any of you that do yoga, more of like a warrior type position to get that front chain of the leg more flexible. Okay, the lower back stretches, some of these will be similar as I just mentioned. Knees to chest type movements, some sort of sideline twist type movements can be helpful for addressing that. Child's pose and cobra, if any of you do yoga again, are very helpful movements for that. And then stretching for the back of the leg through hamstring stretch can be quite useful. And then the final stretch category for the neck, I'm sure Stacy's will cover this a little bit. Nerve stretching techniques can be helpful. So that's what that first photo is showing, like a Cleopatra type hand. Neck positioning exercises is what that second one with the gentleman with the towel behind his head. Side bending and kind of armpit smelling directed movement of the head. And then sort of positioning exercise for those shoulder blades. So pulling the shoulder blades down and back, sort of a retraction movement is what we call that. Can be quite helpful, again, to kind of take some stress and strain off of the front of the shoulders and then the top of the shoulders and neck.
So we're gonna go into a little bit of lifting mechanics. You guys have equipment, you guys have products, supplies, inventory that you need to lift at times. The most important thing is putting your body in an advantageous position to lift. So you're always gonna wanna keep whatever equipment you're lifting as close to you as possible throughout the entirety of the movement. So when you go to pick something up, you wanna get as close to it as possible. Use your legs to squat rather than bend your lower back. Squat down, pick it up, and whenever you lift it, keep it close to your body. Don't keep anything out front. That's going to put excess strain on your lower back. Keep it close, and if you're going to have to move it side to side, wait until you get to the full upright position and turn your body rather than trying to twist during the movement. If it's heavy, ask for help. Don't be afraid. Do it together. Teamwork makes the dream work. And then ergonomics, you're always going to want to stay at without any strain. Keep your body in the most neutral position possible. So avoid excessive looking down, excessive looking up. You don't want to have your arms way above your head if you're at a computer or styling. You're going to want to stay in a very neutral position to where your body's not having to strain up, strain down either side.
One of the other things we want to have you all pay attention to with ergonomics, y'all are standing on hard floors. It's hard to get around that. But something that you have to consult with your space that you're working in, of course, but we recommend standing on anti-fatigue mats. Are any of you familiar with what those are? Okay. So those are really helpful for the lower extremities, especially because that's just helping with the shock and the forces that are going up your legs from lots of standing. So those can be really useful if you're not using one currently. Supportive shoe wear is extremely important for y'all if you're on the floor for long periods of time. And then the other big thing that we talk about for people that have lower body pain that stand a lot is trying to weight shift, right? So you see us doing it up here. I'm sure y'all do it. If you can get your leg up on something, on a stool, if you can be shifting from one leg to the other when you're doing things, changing your stances when appropriate, that can help, again, just decrease the amount of time and the amount of stress going to each of those joints. So those are the big things we wanted to talk with y'all today about. So what we'd like to do next, we're going to pass out some handouts to y'all, but what we'd like to do next, I know that was quick, but we'd like to go save some time for any questions that y'all might have.
One thing we didn't cover, or I didn't cover at the beginning, we are in network with Blue Cross Blue Shield at our clinic just down the street. If anybody has that, we are in network there, and also with Medicare. So.
Any questions?
Yeah, if you want to pass on, thank you so much. Thank you guys for having us.
Yeah, thank you. PT can be quite helpful for that, to be completely honest. Some of it is probably because you have a lot of muscle tension. I don't want to speculate, but you probably have a lot of muscle tension surrounding it, which then makes it difficult to bend and to rotate. So physical therapy, massage therapy, those kinds of things, chiropractic care, depending on where you're going, can be really helpful for those things if you have the time to do it. But yeah, those stretches on there initially should probably help with that if it's, yeah. Do you want us to leave these right here? Thank you so much. Yeah. Good question. Yeah, it's a good question.
Yeah, so if you were to come to physical therapy, we would do a full evaluation. We can help steer you in the right direction. Right, so we'll do a full evaluation, kind of look at your problem area and then just above, just below, and assess and see what would benefit you the most, whether it's more traditional massage, provide you with the stretches and exercises that may help, or a combination of them.
We may be a little, but I said we may be a little bit biased, but our kind of view is probably a good blend of all three. So we would typically, if we think it needs something like an adjustment, we would typically, if we can't do it, which we can do some, if we can't do it, we would point you in the direction of chiro. In addition to like, if you need some strengthening and stability exercises, we can do that with you. We may also recommend massage like kind of in conjunction with that, or as you kind of finish out PT, it's just like a maintenance thing. So.
Of course. Any other questions? Anything? Oh, yes. Ask and answer. Go for it.
With tailbone pain, some of those can. I would probably use like the hip stretches that are on there, like the piriformis type ones first. Something that might be helpful for you. We have a pelvic floor physical therapist at our clinic right up the street. Her name is Mary. Tailbone pain is something that we see in physical therapy, not super often, but we often tend to send it to her because she's the specialist in that area. Yeah. Yeah, yeah. Yeah, those stretches would be helpful. Just the lower back and the hip stretches could probably help you. But if you're not feeling like it's kind of hitting the mark for it, then I would probably reach out. Yeah, yeah. So yeah, you can email. Whose card do you have on there? Mine or Grant's? Okay. Yeah, you can email me if you have questions, and we can try to help you. Yeah, you're welcome. Yep. Yeah.
Okay, so I have scoliosis, and as I've been getting older, I was like, think about it. So should I just like, I don't know, should I get more massages or like,
Massage.
I mean, it hurt like if you don't have like, I'll like scoliosis on.
Yeah.
Yeah, massage can definitely help with more of like a short-term relief and like feel good kind of intermittently. With scoliosis, we know it's not going to change, right? It's not going to go back. So it's just going to be a lifelong program of just keep continuing with the stretches, continuing with that massage therapy, continuing to strengthen the opposite side, things like that.
Perfect. Any other questions? All right. Well, thank you so much, Dr. Reilly and Dr. Gros.
Thank you guys. Good luck the rest of the way.
Thank you. Thank you.